Services. As always, I will start by sharing our data. So fortunately, this week, we did not have any additional COVID-19 cases amongst the people we support or the staff or the provider staff who work with them. And so we are still at a total of 614 people we support who have contracted COVID over the course of the pandemic. And this includes one person in a correctional facility, 14 in host homes, 126 in intermediate care facilities, one in a mental health facility, 118 in natural homes, two in a nursing home, six in out-of-state placements, 50 in residential habilitation, and 296 in supported living placements. So the 126 people in intermediate care facilities represent a little over 40% of people in intermediate care facilities who have contracted COVID. Of those, we have had 28 people who've died, but only 13 of these are confirmed COVID deaths, representing just about 10% of people in ICFs who contracted COVID and had a confirmed COVID death. In natural homes, it's been about just under 13% of people in natural homes who have contracted COVID. Of these, there have been 6 deaths, but only 5 are confirmed as COVID deaths, representing a little over 4% of people in natural homes who have contracted COVID and had a confirmed COVID death. In residential habilitation, 50 people who've contracted COVID represent a little over 45% of people in residential habilitation placements. There have been 3 deaths, but only 2 are confirmed COVID deaths, representing about 4% of people in ResHab who've contracted COVID and had a confirmed COVID death. In supported living, the 296 people have contracted COVID. Of those, there have been 27 deaths, but only 16 are confirmed COVID deaths, representing about 5.5% of people in residential habilitation, in supported living who have contracted COVID and have had a confirmed COVID death. So overall, in DDS, 614 people who contracted COVID represent about 25% of people supported by DDA. Of those, there have been 68 deaths. 30 of those have now all been confirmed as not COVID related. So we've had 38 confirmed COVID deaths that represent about 6% of people supported by DDA who contracted COVID and had a confirmed COVID death. So in February, we had 3 people who contracted COVID, and all 3 were in natural homes. I know there was a question last time about the vaccination status of those 3 people. So 2 were fully vaccinated. For one of them, 2 were up to date with their vaccinations. For one of them, that meant they had a booster. The other one, it was too soon for a booster. And the third person had received their initial vaccinations, but had chosen not to get a booster. So people requiring hospitalization, there were no people, none of the 3 people diagnosed in February required hospitalization. As I said, overall deaths, there have been 68 people who had COVID and have subsequently died. 30 of those have been confirmed as not COVID-related deaths. And so the last confirmed COVID-related death that we have was in September of 2021. As I indicated before, provider staff testing positive. We had no additional provider staff test positive in the past week. So there have been 1,001 provider staff who've tested positive. 61 of these staff have been reported by more than one agency, and 10 provider staff have died from COVID. And vaccination, amongst the people we support, we're at 87% vaccinated. In host homes, it's 95%. Intermediate care facilities, 99%. Natural homes is 77%. Residential habilitation is 99%, and supported living is 93%. In terms of boosters, for people who are eligible for the booster, 70% have gotten a booster. And those numbers continue to go up between getting boosters and getting boosters documented. Amongst our provider staff and DDS staff, both are still at about 96% in terms of their vaccination rates. As people are aware, DC Health has updated their regulation requiring a booster for provider staff, and we'll begin tracking that in March. So the provider staff vaccination rate and the DDS vaccination rate currently reflects only the people getting initial vaccines. DDS, all district government employees have had to document that they are current with their vaccines by February 15th, and we'll be monitoring that by March 15th. There we go. I was having trouble getting my screen back to the right size.
Directories, you are still sharing your screen right now? We're good.
Did you say I'm still sharing my screen?
It was, but it's down now.
Oh, so the other thing to keep in mind is, as people, I believe, are aware, the mayor did end the mask mandate in the District of Columbia, effective February 28th. And so what that means is that there's no longer a requirement that a number of different businesses require people to wear a mask when they come in, keeping in mind, that you should pay attention when you are coming into a store, because the fact that the district has said they don't have to does not mean that they cannot have their own requirements. Now, the mask mandate is no longer in place. For example, as of 11:59 Monday, February 28th. So that would start on Tuesday, March 1st. Restaurants, bars, taverns, places of worship, gyms, recreational facilities, grocery stores, none of these beginning March 1st will require a mask any longer. And if people are following the coronavirus.dc.gov website, you will see that the community spread is now at moderate. And so that's a good thing. um, we will still require masks. Masks are still required in all of our license placements. Masks are still required for district government employees interacting with the public and the public interacting with DC government employees. So if someone were to come to our office, when you come into our reception area, masks are required there, and masks are required for our employees and for people visiting the office. So we continue this progress. So face shields and protective eyewear, people should refer back to the guidance, keeping in mind that face shields are, and I could just defer to DC Health, but face shields are required for particular procedures. And I don't believe that has changed. Those procedures still present risks. And quite frankly, many of those procedures present risks for transmission of other things. But I think Nelson is with us and he could address the face shield question.
Give me just 1 second, Director Reese. I want to pull it up so I can read directly from the guidance. So just remember that eye protection is based on the level of community spread as reported by the CDC, not on the DC Health website. So please make sure to check that. The directions for when eye protection is necessary is on page 4 of the guidance for PPE for healthcare facilities and alternate care settings that was posted on October 1st of last year. Remembering that during patient encounters, healthcare providers that are within 6 feet, patients or residents, or in this case, person supported, while indoors, are required to wear eye protection while DC is in substantial or high levels of community spread. I believe that I did see this morning that the CDC has changed us as of today down to high levels of community spread, but that still means that eye protection is required. And then once the CDC's level has gotten to moderate or low and sustained that for 2 weeks, then eye protection would not be required at that time. Eye protection is still required for aerosolizing procedures or procedures where contact with bodily fluids or secretions is likely. So all of that can be found on page 4 of that guidance.
So how are providers dealing with employees who do not want to be boosted by March the 1st as required, especially family members who are employees as well? Could providers share some of what is working for them? So I'll ask, and this is actually a good opportunity to also present another topic, which is as we move into March, what I'd like to do is begin a conversation with folks about shifting this forum a little bit beginning in April, I would say, where it is a routine part of what we do, not just related to COVID, but um, you know, a way for us to have regular communication with all of our stakeholders. Um, and my hope is to also figure out a way together that we can have more of a hybrid type meeting so that people can participate remotely, but that we can have people in person as well, and that we can have opportunities for people to share ideas and not just have this be DDS making or DC Health or DHCF doing presentations, but really have a regular opportunity for people to share um, ideas with each other and for us to figure out a way to have this be a regular meeting where we come up together with the agenda and share ideas with each other. So I'll be reaching out to people in the month of March so that we can transition to a more permanent and regular part of how we do our business beginning in April. And so if people want to share what has been effective for them in terms of people who are now resistant about boosters, even though they've gotten a vaccine, or about how they deal with family members who are serving as DSPs who don't wish to be vaccinated, if other providers have suggestions about that, if they could please share them in the chat. My understanding is there was a request made for the extension of the compliance date for boosters. Where is DDS on this in reference to monitoring? Um, so my understanding is that there was a request made directly to DC Health. I know we forwarded on the request that we received. This is related to a DC Health regulation. And just as a reminder to people, um, we handle this requirement in the same way that we handled the initial vaccine requirement, which is that having the vaccine, being current on your vaccination, is a qualification requirement. And these qualifications are reviewed in the normal course of provider certification review. As our providers know, during provider certification review, a random sample of employee records is done. And at that time, they would be checking this in the same way they check all other employee qualifications. And if at that point it were a concern, they would then enter into a corrective action plan with the agency to address that concern. In the same way, for some people, if they are not current with their vaccinations, that will put in jeopardy renewing whatever health license they have. And those kinds of things are also checked during our reviews. So Nelson has shared in the link the document that he was referring to. Some other updates for people. At DDS, so DDS is offering for the people that we support computer and technology in-person training, and it helps people to learn, whether it be navigating if they have they want to learn more about how to use a smartphone, or they have a tablet or a computer, through a partnership with the Office of the Chief Technology Officer. We're providing some training sessions here at DDS. There's still room in the one that is on the 21st of this month, of March, sorry. And we are working on looking at dates for April. And so it's, it's experts that are there to help people one-on-one, to troubleshoot problems they may have, to help them learn skills about using equipment. But you must register in advance. The size of the groups is limited because they're in person. And I will put in the chat the link so that people, if they are interested, can register. I will say it is a small group because um, in order to maintain distance and because it's in person. But there are 5 slots still in for the March 21 session. And as I said, we are looking at, oh, this didn't copy the link. I'll try this another way. That should do it. So this is the link so that people can register. You can also, if you are interested, contact Charlisa Payne at Charlie. Oh, I'm going to put her email here in the chat. It's charlisa.payne2@dc.gov. And she can give you more information about those sessions and about upcoming sessions that you could register for. Also, as a reminder, on Monday, the 28th, we will have our next HCBS committee meeting, and they will be talking at that meeting primarily about self-direction. And that is from 1 to 3. For people we support who may be attending, they can also reach out to us. We have a session from 12 to 1 to go over any documents to make sure that they're prepared to fully engage in the session at 1 o'clock. So there was a question about the Appendix K makes reference to, it says here, enhanced Medicaid rates lasting 6 months after the public health emergency. It says it isn't specifically written out. In fact, so the Appendix K, so initially CMS did not provide for the flexibility allowed in the Appendix K to continue beyond the public health emergency. However, more recently, they have said that 6 months following the end of the federal public health emergency, we can continue to keep these flexibilities in place. And we have stated, since CMS allowed for it, we have stated that in our Appendix K, and it continues to be our intention. Oh, and also by way of update, we have been having regular meetings with the telehealth provider. Station MD has met with folks. We have, it appears things are in place so that during the week of March 14th, they'll be delivering and installing equipment to all homes. They'll be conducting training, including for provider nurses, March 22nd to the 24th. We expect that this service for all of our folks in post-home ICF, ResHab, and supported living will be in place by the end of March. So we're looking forward to seeing how that implementation, how that goes. There's a question here. All staff is required to get booster shots, correct? I think more accurately, all staff are required to be current with their vaccinations. So, for example, if a staff person got the Moderna or Pfizer and their second shot was in January, then they would have 5 months to get a booster. So, and it says, what about exemptions? The exemptions for boosters are the same as the exemption for the underlying vaccination. So, as people are aware, DC Health has received a large number of requests for waiver, either based on a medical reason or a sincerely held religious belief that a person has that they believe prevents them from getting a vaccine. DC Health is considering each request for a waiver individually, and so it is taking some time. Until that has been considered and denied, the person is not expected to get the vaccine. So for folks who you have working for you currently, who have sought a waiver, they or for someone who comes on who is going to say that they should be exempt, they are allowed to submit an exemption request to DC Health, and once that has been either granted or denied, you then proceed accordingly. As I did say earlier, 96% of our provider staff are current with vaccination, not counting whether I'm sorry, I shouldn't say current with, have received a vaccination, and we will begin tracking in March whether people are actually current based on their due date for booster shots. And as a reminder, next week begins DD Awareness Month, and we actually have quite a number of events. I think Jared announced them last week, but I can go over them again. Quite a number of events during this month, including the first one next week. On March the 2nd is the book. I'm going slow while it opens. The Next Chapter Book Club will meet March the 2nd from 5 to 6. There's going to be on March the 9th, DD Council's Kevin Wright, formerly of DDS, will be sharing his personal employment stories and systems change. He'll be doing a presentation from 3 to 4. There's an event, people who may have been aware of our Latinx conference that started, we've had our third one, so a little more than 2 years ago. We are doing our first Ethiopian conference, which will be an event all in Amharic. And we'll have our first event March 16th from 6:30 to 7:30 to talk to the Ethiopian community about services that are available to them. There's a creative writing session March 18th from 1 to 2. A talent show March 23rd from 7 to 8. Quality Trust DD Month event is on March the 24th. And the annual DD celebration is on March the 30th, and that will be from 3:30 to 5. And in the chat, there is Health and Joy has the invitation for their virtual monthly party with a live DJ from 6 to 7. And that is today. All of these events should be posted on our website. And by should be, I mean after this meeting, I'll be checking, and then I will make sure that they're there. So, but by March 1st, you will see all of these events posted on our website with the proper links so that you can attend whichever ones you are interested in. What is the status of DC Health responding to exemption requests, as providers have people who have requested exemptions and have not heard anything? As I said, they are responding as quickly as they can. The law requires that each exemption request be considered individually and that there be some discussion with the person. And so, or some, consideration, there needs to be full consideration of the request. And it cannot be once they've said, well, this kind of request is denied. Every single request has to be considered individually, which is causing this to take them more time than they had hoped for. So they are moving as fast as they can. Are contractors and staff that telework with 1099s required to get the booster? If you go back and just refer to the DC regulation, it includes which staff are required to have the booster. So I think the way that you pay a person doesn't matter. What it has to do with is the kind of work and the kind of contact they have with the people we support that makes the difference. And so, and the booster language was just added to the original regulation. And it was just added to say you must be current with the vaccine so that they don't have to go back in the future and change it again. It doesn't say, you have to get this booster. It says as of March 1st, going forward, you have to be current with COVID vaccination. Thank you, Allison. And all Developmental Disabilities Awareness Month activities will also be posted on the DD Council's website at ddc.dc.gov. I was just scrolling through to see if I missed any questions. And just as a reminder, if there are providers who have found any successful strategies for dealing with employees who don't want to be, it says don't want to be boosted, but also don't want to be vaccinated. And especially family members who are employees, could you share those in the chat for other providers? Thank you. Okay, it's almost 12:45. We don't seem to have other questions. If that's the case, we can end at 12:45. So I hope everyone has a nice weekend. Stay warm, although I don't know if spring's supposed to be back over the weekend or not, like it was earlier this week. And we will talk again next week.